Hey guys, welcome back to the channel. This is Pawan, and for those of you who've been following my channel for a little bit know that I work in emergency department of one of the hospitals in Sydney as a registered nurse. And in this video, I'm going to go over 5 reasons of why you should consider working as an emergency nurse. Emergency departments, by their very nature, are chaotic locations, and because of that, working in emergency can be tough. Time moves quickly in the ED and there's not a lot of time to adjust. 1 minute you might be looking after a critically declining patient who's been in a major car accident, and the next minute you might be looking after a patient with a common cold. Every day is different. Although working in ED might be too fast-paced for some nurses, I myself have found it an incredibly rewarding field. So why should you choose to work in the ED? Well, what makes it tough also makes it exciting and rewarding. Here are top 5 reasons why you should consider working in emergency. The first one is you have no idea what's coming through that door. This is something that emergency nurses love. There is no such thing as a predictable day. You might be looking after an 11-day-old baby as well as a 92-year-old gentleman on the same shift. And it's not just the variety of cases and patients that fluctuate, but it's also the number of patients as well. The unpredictability is just part of the adventure. Secondly, ED nurses have more autonomy. In the hustle and bustle of emergency departments, it's often all hands on deck kind of situation. In this environment, nurses have more autonomy to decide how to treat their patients than other parts of the hospital. And because as an emergency nurse, you're constantly looking after critically ill patients, you learn to quickly adapt to urgent situations and work autonomously. This not only allows more room to make clinical decisions, but it also builds strong partnership with other nurses and doctors. Number 3, ability to think on their feet. Now, there might be no time to pause, but as an ED nurse, you learn to think on your feet. You become good at problem solving, and most of the time you don't even know what's wrong with the patient when they present to you in the emergency department. But you must figure it out and treat them before they leave. So it's like working in a team of detectives, but with a human body. I found this incredibly exciting. Number 4, shift work. For those of you who would rather work less days and longer shifts, ED might be a good option for you because most of the emergency departments across Australia offer nursing staff longer shifts. Unfortunately, my department only recently moved to longer shifts. We used to still do 8-hour shifts, which means I have to work 5 days a week as a full-timer. But recently, we've been working 12-hour shifts as well, which means that you work less days and you have more time with your families or do things outside of work. Number 5 is ongoing education. Now, doing all the detective work and seeing a wide variety of patients and making choices about their treatment plans, as an emergency nurse, you are involved in constant education. And not only that, due to rapid patient turnover, patients don't stay in emergency department for more than 4 hours, which means that on a 12-hour shift, you will at least see a few patients and you are responsible for a few bays as well. ED nurses work across several medical disciplines, gaining valuable information in different areas of nursing field, from trauma to pediatrics. So guys, those were the top 5 reasons of why you should become an emergency nurse. I hope you found this video useful. If you did, please give it a thumbs up. And if you do have any questions regarding this topic, please drop them in the comment section below. And I'll see you in the next video. Bye.